everyone, and Ramadan Kareem to you all. Welcome to our webinar today. Many thanks to IFSA Bangladesh for organizing this session, and I'll be running a quick presentation to make sure I cover all of the learning objectives, and I will have a quick question answer session at the end to fill in any concerns that you may have. So without any further ado, let's start. I am Emiko Sultana, and I am an international medical graduate from Bangladesh. I have started working in the NHS as a trust grade doctor at a foundation year 2 equivalent in June 2019. I have secured a national training number in core surgical training under Health Education England and will be starting core surgical training from August 2020. During this journey, I've come to know a lot about how surgical training works in the UK, and I'll be sharing this knowledge with you in the webinar today. So our learning objectives for today are surgical career options and opportunities, whether you should be going for Plab or MRCS, training job versus non-training jobs, how you should prepare for the surgical job interview, and academic options that are available for you in the UK. So first off, let's start with some surgical career options that you have in the UK. The top 10 recognized surgical specialties, if we list them from 1 to 10, would be general surgery, neurosurgery for all you future Derek Shepherds out there, ENT, cardiothoracic surgery for the future Devi Shetties in the audience today, trauma and orthopedics, urology, vascular surgery, and plastic surgery, pediatric surgery, and academic surgery. Now, next we're going to talk about some of the stages of training that you can be a part of while you are doing your career in the UK. So we can divide the stages of training in the UK into 4 parts. So we'll start with your job as a foundation doctor, which is 2 years, then a core trainee doctor, which is another 2 years, a specialty registrar, which is a total of 5 years in most surgical specialties. Notice how I made this box a bit bigger than the other because this is the longest path inside your surgical training route. And finally, you become a consultant. And notice how the box of the consultant doesn't end, which means that you will be a consultant for the rest of your life once you finish all of these stages of training. Now, what are your responsibilities as a foundation year doctor? When you're in foundation year training, you would be doing a surgical rotation and not a surgical job. Therefore, I'm afraid to say it's a bit too early to be calling yourself a surgeon when you are in your foundation years. When I was doing my internship in Bangladesh, my internship consisted of 4.5 months in surgery, 4.5 months in medicine, and 3 months inside gynecology. As a result, during my surgery placement, that's the time when I decided that I wanted to pursue a career in surgery, which might be similar to something that a lot of you are feeling and therefore are here with me in the webinar today. When you're inside your foundation years, as a doctor, you will be having to assess surgical patients in the ward. You'll be doing minor procedures such as suturing and maybe draining of abscesses, and you'll be assisting in simple surgeries such as an appendectomy. After this, you enter into core surgical training, which in the UK consists of CT1 and CT2. You will be working inside a surgical job as a core trainee, which means that as a core training doctor, you would be doing certain rotations inside your surgical field. For example, you may have 4 months inside general surgery, 4 months inside trauma and orthopedics, and 4 months in pediatric surgery, and similar rotation from those 10 specialties that I've shown you initially as part of your core training job. While you are a CT, you will be having to manage surgical patients in the emergency department and in the ward. You will be allocated time in theater to learn certain surgical procedures. And you'd be advised to attend outpatient clinics in order to learn patient management. So during these years is when you learn to become a surgeon, how you learn the proper skills that you require for management, etc. The next part inside your training is when you train as a specialty registrar. At this point inside your career, you are sure that you want to be in which field of surgery. For example, let's say after your core training years, you decide you want to be a specialist in trauma and orthopedics. In this situation, you will be the trauma and orthopedics specialty registrar. As a specialty registrar, you will be independently carrying out surgical procedures and theater lists. You will be independently assessing patients inside clinics, which means all the way starting from your history, examination, to diagnosis, investigation, and treatment. All of them would be done by the specialist registrar by themselves. The specialty registrar is the first point of contact for admission of patients with surgical problems. For example, if a patient comes after a road traffic accident and let's say has a seatbelt injury with a splenic laceration, in the UK, the surgical registrar carries the on-call phone or the on-call bleep. Therefore, they're the one who are going to receive the call, go to the emergency department, and initially manage this patient. Finally, a specialty registrar takes part inside management of complications. Let's go back a little bit into what is the job of the foundation doctor. So our foundation doctor is going to be assessing a patient, finding out that this patient has low blood pressure. When we find that this patient has low blood pressure and we start the patient on fluid, the core trainee is going to find out that maybe this patient has an anastomotic leak. Once the core trainee is able to do this, they will inform the surgical registrar. The surgical registrar would be the one who would find out that this patient needs to be taken to the theaters, plan out the steps that are required to treat this patient, and possibly carry out the operation themselves. So it seems like a lot of responsibilities, but a surgical registrar is usually very, very well prepared to deal with these situations, because if you've noticed, specialty registrar training is for a total of 5 years. So by the time the doctor is in ST8, they're usually quite able to manage these complications. Moving on to the job of a consultant. So you have finally reached the end or the paradigm of your career, and you are now confined to a subspecialty. Going from my previous example, where if you decide while you're a registrar that you want to specialize in trauma and orthopedics, as a consultant, you can choose your subspecialty within trauma and orthopedics. For example, a consultant who specializes in foot and ankle surgery. A consultant is independently able to carry out the more complicated surgical procedures and theater lists, and they independently assess patients in clinics, but they do so with the more intricate patients who require a more complex line of treatment. Consultants in the UK play an active role in training future surgeons as well. They play an active role inside research in order to make sure that the future of surgery stays as dynamic as it is at the moment. Finally, a consultant plays an important role inside management and administration as well. Our next part is, if you're an international graduate like I was myself, a very important question that many of us ask is, should I be going for Plab to get my GMC registration, or should I be giving my MRCS? Now, there are some important similarities and differences between each of them, and I'm going to be discussing these so that the decision is a bit easy for all of us. Now, what are the similarities between Plab and MRCS? So inside the Plab, both inside the Plab and MRCS, you will get full GMC registration. Both inside Plab and MRCS, you would be, one second please. Both inside Plab and MRCS, you would be having to give your IELTS or your OET in order to make sure that you get your full GMC registration. Both Plab and MRCS consists of two parts. So Plab 1 and Plab 2, MRCS Part A and MRCS Part B. What are the differences? So comparatively, Plab is a lot easier than MRCS. Most candidates can pass their Plab exam by studying for it alongside their house job or internship, or alongside their own, right after medical, you finish your medical final prof exams, you have a few months in between. Even that time could be utilized to prepare for your Plab exams. MRCS, on the other hand, requires designated time separately in order to study, and it's quite challenging with a full-time job. So difficulty-wise, MRCS is harder. We'll next talk about the pass rate. Plab has a much higher pass rate than MRCS. The pass rate for Plab globally is known to be about 65 to 75%, which means about 7 out of every 10 candidates who sit for the exam are going to pass. MRCS, on the other hand, when I was giving my MRCS Part A in January 2019, the statistics stated that there were only 34% of students around the world who have passed their MRCS Part A. For MRCS Part B, the pass rate is somewhere around 50 to 60%, which means that only about one out of every 2 candidates would pass, which sounds good, but if you think about it this way, 1 out of every 2 candidates will also fail. As a result, MRCS takes longer to complete than Plab. Generally, a candidate can finish Plab inside 1 or 2 years, while MRCS generally takes about 2 to 3 years. The cost of the exam itself, so Plab costs a little less than MRCS. So combining the Plab 1 and Plab 2, the cost of the exam itself is about £1,200. আমাদের দেশি টাকায় যেটা হচ্ছে 1,20,000 1,30,000 এর মতো পড়ছে। And for MRCS, the total cost of the exam is about £1,700. আমাদের দেশি টাকায় যেটা 1,70,000 1,80,000 কাছাকাছি পড়ছে। So overall, the cost of the exam for Plab is lower than that for MRCS. Now, once you have gotten your GMC registration, finding your first job in the UK is comparatively more difficult if you have Plab, only Plab, compared to MRCS. This is because when a consultant is interviewing you for your first job, if you have an MRCS, it shows that you know how the surgical line works in the UK, you have that experience, you have that knowledge. So most candidates who get their GMC registration after passing MRCS get their jobs quite quickly as well. Need for further exams. If you've gotten your GMC registration after passing Plab and you want to be a surgeon, at some point or the other, you will definitely have to give your MRCS, and at the later stages of your training, you're going to have to give FRCS. If you pass your MRCS, you're good with exams for the next few years. You don't have to think about your FRCS until you are an ST5 or ST6 candidate. So you have a good few years where you don't have to give another exam. Finally, and possibly my strongest argument, is entry into national training. So with the Plab route, entry into national training is less challenging. In other words, it's easier. And with MRCS, it's more challenging. In other words, it's more difficult. In order to explain my last point, I'm going to have to show you how the training pathway in the UK works. The training pathway starts with your foundation year 1 and 2. During this stage, once you are done with your foundation year 2, you are able to sit for an interview. Notice the first yellow box that I have over here, which is called your core surgical training interview. Once you give your core surgical training interview, there are two routes you can enter. One is an uncoupled training, the other is a run-through training. An uncoupled training consists of core training year 1, core training year 2. Within these 2 years, you're going to have to finish your Mrcs exam, and then you're going to have to sit for another interview. Notice the second yellow box over here. And then you're going to get your ST3 job and continue until ST8. Within this time, you have to complete your FRCS. Then you get CCT, which is Certificate of Completion of Training. And then you give another interview in order to become a consultant. In run-through trainings, you give your core surgical interview the same as you did for the uncoupled training, but you don't have to give another interview until you're done with ST8. There's a process called benchmarking instead of an interview between ST2 and ST3, where they just make sure that you have completed your Mrcs, you have all of the operations and procedures that you require for becoming an ST3 registrar, and then you progress smoothly into ST3. Now, run-through training is definitely a lot more convenient, and for certain specialties, it is the better option. For example, cardiothoracic surgery, neurosurgery. Previously, they used to have only run-through training jobs available. Currently, general surgery, vascular surgery, ENT, trauma and orthopedics are also starting this run-through training. And personally speaking, I think run-through training is the best type of job that any aspiring surgeon can have in the UK, because the department that you're training under knows that you'll be staying with them for the next 8 years, for which they take special care into training you and making sure that you are a good surgeon once you complete your training. Secondly, for international medical graduates like ourselves, it makes things easier to have one hospital guarantee that you have a job for the next 8 years in terms of applying for your visas, in terms of getting your indefinite leave to remain, and eventually your passport. Going back to my point on Plab versus Mrcs, once you get your GMC registration via Plab, you will most probably join as a Foundation Year 1 or Foundation Year 2 equivalent. So your first job would be of an FY1 or FY2. During this time, you can prepare your portfolio so that you can sit for the core surgical training interview and then enter into the training pathway similar to most UK graduates. Now, if you get your GMC registration after giving Mrcs, sitting for this interview becomes a little difficult. The reason being, if you are giving your Mrcs, I've mentioned before that you've probably taken about 2 to 3 years to complete your Mrcs. One of the catches of the core surgical training interview is that you cannot have more than 18 months of surgical experience, which means that if you are sitting for your core surgical training interview after passing Mrcs and you do have more than 18 months of surgical experience, you will be overqualified for this interview, therefore will not be able to sit for it. So most of these candidates end up giving their starting their training as a core training 1 or core training 2 doctor and try to sit for the ST3 interview. The problem with this is that the ST3 interview is much more competitive compared to the core surgical training interview. If the ratio of applicants is to training positions available for the core surgical training interview is 3:1 or 2:1, for the ST3 interview, the ratio would be something around 5:1 to even 10:1 for more competitive specialties, for example, neurosurgery or cardiothoracic surgery. Therefore, and there's also another rule, which is if you have more than 48 months of experience, you will not be allowed to sit for your ST3 interview either. So in this situation, I know a lot of us might be in the situation that I was preparing for MRCS. I've already passed 18 months of surgical experience. What should I do now? Another option that is available for doctors wanting to train in surgery in the UK is the non-training pathway. So the non-training pathway is where you progress from FY1 or FY2 all the way till ST8 as a trust grade doctor. So what is a trust grade doctor? A trust grade doctor is a non-training doctor, someone who's not in the national training program. Now, there are certain benefits and downsides of being a trust grade doctor, and I'm going to talk about them inside our next segment. So what is the difference between being a trainee and a trust grade doctor? Now, as I mentioned before, becoming a trainee inside the national training program in the UK is quite challenging, and you have to pass through a competitive interview in order to make sure you get this job. However, getting a job as a trust grade doctor is very easy. All you have to do is put on your application and your CV through the NHS Jobs or Track Jobs website, and it is quite easy, especially, and you can apply any time of the year, which makes it a lot easier than applying for your core training job or your ST3 job. Location. When you're applying for the national training, Health Education England is going to be giving you the location that you're going to be working on. And usually this is not, many of the times this is not going to be the one of your choice. It's a lot like the medical college, government medical college admission tests inside Bangladesh, where based on your marks, you get allocated into certain medical colleges where you're supposed to be doing your training. So your location as a trainee is not dependent upon you, it's dependent upon how well you do in the interview. As a trust grade doctor, on the other hand, you can choose where you want to work. So you get a lot more flexibility in terms of location. Training doctors get an organized mandatory teaching session. There's one which is arranged once every 2 weeks. There is some departmental teaching that goes on every week or twice or 3 times a week. And as a trust grade, you will be able to attend the teaching sessions, but it's not as organized. And whether you attend or do not attend, no one would be really monitoring you about it. Moving on to theater time. Now, as a trainee, you'll be allotted theater time every week. And during this time, you will have a supervisor who will make sure that you learn all of the important surgeries and make sure that you pass on to the next stage in your training smoothly. As a trust grade, you are not allotted any theater time, so you can only go during your free time. So what most trust grade doctors end up doing is working either past their normal shift hours, sometimes they come in the weekends, but otherwise, because they're not allotted that time, it makes learning things in surgery a bit more challenging. Moving on to career progression. As a trainee, your career progression is guaranteed. I've showed you in the previous slide that core surgical training generally takes about a total of 8 years to finish, starting from your ST1 all the way till ST8 or CT1 to ST8. It takes you about 8 years to finish your training and get your certificate of completion of training. As a trust grade doctor, I have seen many of registrars and who are now consultants who say that it had taken them up till 15 to even 20 years in order to complete this training. So what's the reason behind this? Why does it take longer as a trust grade than it does as a trainee? This is because the number of hours that it takes for you, that you are allocated in theater, varies massively. Because there are only a limited number of operations that occur in each working day, if the trainees are allotted for theater time, the trust grade doctor will not be getting the same theater time, for which they will not be able to satisfy all the criteria inside their portfolio, making their completion of training a bit more challenging. The second part is the teaching sessions. Now, you might think 1 or 2 teaching sessions are not going to make a massive difference inside my life. But if you think about maybe a teaching session once every 2 weeks, which goes on for 8 years, it's pretty clear that the knowledge that a trainee would get in 8 years of all of these teaching sessions is much more rich and knowledgeable, with the cumulative effect that it has by the time they are done training, compared to a trust grade doctor who will be able to maybe attend one teaching every 3 to 4 months. Next is, as a trainee, you will be getting more support from your trust in terms of finance and assistance to attend courses and pursue higher degrees. As a trainee, sometimes the trust would be giving you, for example, a fund in order to complete your ATLS course, to sit for your MRCS or FRCS exams. Trust grade doctors, unfortunately, do not get as much of this allowance, if any, and are often not supported to the extent that training doctors are. Finally, when you're in the training program, you develop a better rapport with your department. As a result, they invest more time and energy into you because they know that they're going to be pretty much stuck with you for a long period of time. So if you become a good surgeon, it would be more beneficial to their trust, as opposed to a trust grade doctor who can switch jobs anytime they want, and therefore often the employers, which would mainly be your consultants, would be a bit skeptical about investing as much time and energy into developing you as a great surgeon. Now, if I have convinced you that National Training Scheme is quite an important journey for, and all international medical graduates should try to enter into training as soon as they can, I want to spend a few moments talking about how the training interviews work in the UK. I did mention that it is competitive, but my firm belief is that nothing is impossible if you put in the proper hard work for it. So the parts of the interview consist of 3, which is the clinical scenario station, where you'd be given a particular case. For example, a 13-year-old boy fell off the roof of his house and came in with his arm bent towards his body. His arm is swollen. The pulses are very feeble. How would you further assess this patient? So the way that we structure our answers is mentioning, make sure that he did not have any other injuries, such as a head injury, make sure his airway is okay, breathing is fine, circulation's all right. Go on to your secondary survey, where you can diagnose clinical signs on what might be going on. Most of the scenarios that they give inside this interview would be situations like compartment syndrome or an ischemic limb. And then you further go on to how to manage this patient. The clinical scenario station is quite easy to pass if you study the books well, and if you practice properly with either your colleagues, or if you work in the NHS for a while, you learn how the management system works in the country. The next part is the leadership and management station. This station focuses mainly on how you would act as a surgeon in situations which may challenge the everyday harmony of the hospital. For example, you might be asked, how would you use your leadership skills in order to help out a colleague who seems to be overstressed with work? Another scenario that they might ask is, you notice that your current rota is not giving you enough time inside theaters, but is giving you too much time in the wards, and you think that this is affecting your progress as a trainee. How will you diplomatically resolve these issues with your colleagues? Leadership and management and the clinical scenario stations can be studied and practiced in order to become an expert in them through some of the books that I've given inside this slide. Now, the most challenging one is the portfolio station. And this is the one which, interestingly, you can start working on now. Even if you're a current medical student, you can start working on this now if you're a junior doctor or an intern. What is a portfolio? So a portfolio is a lever arch binder, which looks just like the image on the picture. And before your core surgical training interview or your ST3 interviews, this becomes pretty much the most important folder of your life. I remember telling my sister when, before my interview, that Allah mafkuruk, if our house catches on fire and you need to run out, make sure you grab this portfolio with you. The reason being that it contains basically all of your achievements in your life. So what would you put inside your portfolio? If you have any, so most of us would be having our MBBS degree when we are sitting for this interview. Alongside that, if you have a master's, if you have a PhD, if you have an MD, you would be getting extra marks with each of these degrees. Any additional achievements, for example, if you have ever been, if you've ever won a particular medical presentation, if you've ever won an award for your contribution to medical science, if you've gotten an honors mark inside any of your exams in MBBS, you would be able to score marks for this. Quality improvement projects or clinical audits, these are not very common outside of the UK, but once you enter into the UK, this is a basic study that we do in the hospital to make sure that the current practices in the hospital are same as the ones that are set inside the national guidelines. And clinical audits, if you do invest your time into it, it's not too difficult to get a few audits. But in the 6 months that I worked before my core training interview, I was able to lead 2 of my own clinical audits and complete the circles. I had a total of 5 audits when I was giving the interview. So if you are interested in it in your early days in the NHS, it's quite easy to make sure that you have these. Next is teaching experience. Now, if many medical students do enjoy teaching as well. So if you're teaching medical students or who are young, who are at a few batches younger than you, or if you're teaching privately, you make sure that you get a certificate or a letter that's signed by a consultant or the head of department, and some feedback from your students, and you can add this in your portfolio. It does add a lot of points. Next is training in teaching. Now, in the UK, there are a few courses you can do, such as Teach the Teachers, some PG certified courses that you can do in order to get training inside teaching. However, these are, to be honest, quite challenging to get once you're, until you actually start working here. The next parts are my favorites, which is presentations. So if you've given an oral presentation or a poster presentation at an international conference, for example, BIMSCON, you will get marks for this. If you have the next part is publications. So if you have a publication, for example, your case report or your research article, you can also get points for this in your portfolio. Leadership and management. If you have been the president, vice president, secretary, treasurer of any organization during medical school or right after medical school, for example, if you're a key member inside IFMSA, Kondhani, Medicine Club, and many other NGOs that work inside Bangladesh as well, you would be able to get some marks for this as for leadership and management. Part I is commitment to surgery or all surgical specialties. So if, for example, in this one, if you have done a course regarding surgery, such as basic surgical skills, advanced trauma and life support, you will get a point for this. If you've given or passed your MRCS Part A, you will get a point for commitment to surgery. Lastly is clinical or procedural experience, both in surgical and non-surgical posts. Generally, international medical graduates, we can score good points inside this because some of the opportunities that we get as foundation year doctors or as medical students, for example, if you've done your own if you've done an appendectomy, if you've inserted a chest drain and you have it in your logbook, you can put these in, which will get you some points. For my portfolio, I would have to say that I'm really grateful to IFMSA for helping me. The reason being that during BIMSCON 2016, I had a case report which I had presented as an oral presentation, which got an award as one of the best presentations. So I got a mark for presentations and for additional achievements. One of our mentors for IFMSA Bangladesh, Deep Bhaiya, I'm sure a lot of you might know him. He thought that this case report was very, provided a lot of rich information and helped me publish this inside a journal and while I was giving the interview, it was under peer review, so I got some marks for publications as well. During 2015 to 16, I was the National Officer of Medical Education in IFMSA Bangladesh, so I was able to get some points for leadership and management as well. So especially with the help of organizations such as IFMSA Bangladesh, you can definitely enrich your portfolio even before you start working inside the UK, which I think is quite special. We're going to go on to the final part before our question answer session, which is what are some of the academic achievements that we can get while we are working as a surgical trainee in the UK. So I'll start off with the MRCS. So the MRCS exam is one that you will definitely have to give at some point inside your surgical career. If you use it to get your GMC registration, that's great. It also helps you get a good concept on surgical practice and how it works in the UK. MRCS is acknowledged by countries around the world, and it offers a better pay as a doctor in many countries such as the Middle East as well. Now, the next one is a master's or a PhD. Now, a lot of people ask the question on, is a master's compulsory in order to become a surgeon in the UK? The answer is no. Is a PhD compulsory in order to become a surgeon in the UK? No. However, if you do have a master's degree, it does give you points when you're applying for core surgical training or specialty register training. As I've mentioned before, this is part of your postgraduate qualifications and degrees. While you're doing a master's, you also get tons of opportunities for research and to get your own publications. So it definitely helps you inside your applications. And having a master's for your general interest inside surgical science opens a lot of doors for you in terms of your own personal development. A master's in the UK is actually quite convenient because you can do a part-time master's or a distant learning master's in the early years of training. Now, what about a PhD? Now, a PhD generally takes about 3 to 5 years and you would usually be having to take some time off of training in order to pursue a PhD. Having a PhD gives you points definitely for core training, for specialty registrar training, and it also gives you points when you're applying for a consultant job. There are certain specialties inside the UK, such as hepatobiliary surgery, which is very, very competitive. And what is often said is that unless you have a PhD, it's very difficult to make sure that you get this job because all of the candidates generally have a PhD before applying for a consultancy job in hepatobiliary surgery. With a PhD, again, you get many opportunities for research and having your own publications, and you can often be the lead of clinical research in the academic departments inside the hospital, which is often a milestone that many of us do want to achieve at some time in our future. Alongside these, you can do tons of short courses, for example, your basic surgical skills course, advanced trauma and life support course, care of the critically ill surgical patient, and many more that you can find on the Royal College of Surgeons website. And in my opinion, the harmony that you get from learning new skills inside the operation theater and the academic skills that you can learn from the courses and these degrees and basically build up to lead to a very fulfilling career inside surgery in the UK. And for me, I have loved all of the last few months that I've had here, especially working in the surgical department. And I'm quite sure that the future, in my future job, I would start liking it even more. And I'm really excited to know what it brings for me. I'm going to stop sharing the screen and see if we have any questions here. Okay. All right, so, okay, the first few comments are those of you, I'm really sorry, I know some of you were not able to hear. Okay. Okay, click on audio, that worked. Those who cannot, okay. So the first question that we have is, what if I don't complete my internship? I'll get GMC registration after completing Plab 2, or do I have to wait for completing internship in Bangladesh? Okay, so if you have not completed internship in Bangladesh, you're going to have to come to the UK and do a foundation year 1, which is the same as internship. You can get the job by the same application process that I've mentioned before. And once you finish your foundation year 1, that's when you get your full GMC registration. So you give your Plab exam, and then you you do a foundation year 1, and then you go for your full GMC registration, and you do your foundation year 2 as a GMC registered doctor. It's the same as in the UK because all of the foundation year 1 doctors don't have the full GMC registration either. I hope that answered the question. I'm going to go to the chat box again. Okay. Okay, just a second. Okay, our next question was explain run through and uncoupled route. Yeah, I'll go on to this in a bit. Just one second, please. Okay, so going to our question on coupled and uncoupled routes. So if you have, sorry, just trying to figure out the, okay, sorry. So as I've mentioned before about the coupled and uncoupled routes. Okay, so your coupled training is the one where you would be, or coupled or run through training, it's the same thing. You give one interview, and this is a very competitive interview, and you enter straight into ST1, and you progress all the way from ST1 and ST2. Within this time, you must complete your MRCS. You have a basic benchmarking where the consultant just makes sure that you have completed the MRCS, you have all of your achievements that you require to become an ST3 candidate, and then you progress straight through to get your certificate of completion of training. Essentially, if you're into a run-through training program, you work really hard when you're in giving your core surgical training, but once you enter, you essentially don't have to give an interview until you are applying for a consultancy job. So a run-through program or a coupled program is amazing. Uncoupled training, on the other hand, is one where you enter with a core surgical training interview, the same interview most of the cases, but after your CT1 and CT2, you need to give another interview in order to get into ST3. Now, many of the times, the location that you're going to get as a core trainee and the location that you're going to get as a ST3 candidate are not going to be the same, which does become quite challenging for a lot of doctors. But again, I would still say that getting into uncoupled training is better than the working as a trust grade for the entire time of your surgical training because of the advantages of your teaching and operation theater exposure, time that you'll get exposed to the operation theater. Just a second. Okay. Our next question was, glad to hear BIMSCON helped your portfolio a little. I wouldn't say it helped a little, I'd say it helped definitely a lot, because working inside BIMSCON made a massive difference to me in my portfolio. It really helped me with presentations, publications, etc. And I would strongly encourage, I'll strongly encourage anyone who is still an active member of IFMSA in order to continue being an important part of BIMSCON, presenting as much as you can, publish as much as you can as well. Okay. I'll keep going on through our chat box. Okay. The next question was, I still remember that case presentation. Okay, good to know. It was a memorable one. Can I use the audio to ask a question? Yeah, I guess that shouldn't be a problem.
Hello, Emiko.
Hi.
Hi, it's nice to hear you. আচ্ছা, আমার দুইটা প্রশ্ন আছে অ্যাকচুয়ালি। প্রথমটা হচ্ছে যে এটা বোঝা যাচ্ছে যে ট্রাস্ট গ্রেড ডক্টর যারা, এটা মানে লেস কম্পিটিটিভ দেন সার্জিক্যাল ট্রেনিং। তো আমার কোশ্চেনটা হচ্ছে যে এর মধ্যে কোনো ট্রানজিশন পসিবল কিনা, সে কি একজন ট্রাস্ট গ্রেড ডক্টর হিসেবে কাজ শুরু করলো, এর পরবর্তীতে সে মানে সে এসটি ট্রেনিং এ এনরোল করতে পারে কিনা, এটা একটা কোশ্চেন। আর আরেকটা কোশ্চেন হচ্ছে যে মাস্টার্স এর ব্যাপারে তুমি লিখেছো যে পার্ট টাইম বা ডিস্টেন্স লার্নিং পসিবিলিটিস আছে, ফুল টাইম মাস্টার্স এর ব্যাপারটা কিরকম, এটাও পসিবল কিনা এসি ট্রেনিং এর সময়? এই দুটো আমার কোশ্চেন। থ্যাংক ইউ।
Okay, thank you so much, Yamin Bhai. So first question to answer বলছি, definitely হচ্ছে ট্রাস্ট গ্রেড ডক্টর হওয়া অবস্থা আমরা হচ্ছে কোনো না কোনো এক টাইমে আমরা ট্রাই করতে পারি যে ST3 ট্রেনিং এ বা কোনো ট্রেনিং প্রোগ্রামে ঢোকার জন্য। আমি একটু পাথটা বের করছি যাতে হচ্ছে আমরা একটু ইজিলি আন্ডারস্ট্যান্ড করতে পারছি। Okay, I'm sharing the screen to the computer screen. Okay, so আমাদের এই পাথওয়েটার মধ্যে নন ট্রেনিং পাথওয়ের ভিতরে আমরা ধরেন ফার্স্ট ইয়ার আমি যেটা নিজে করেছি, ফাউন্ডেশন ইয়ার 2টা আমি ট্রাস্ট গ্রেড ডক্টর হিসেবে শুরু করেছি। তারপর হচ্ছে আমি একটা ইন্টারভিউ দেওয়ার পরে আমি হচ্ছে ডাইরেক্টলি ST1 জেনারেল সার্জারিতে আমি ঢুকেছি। হ্যাঁ, সো দিস ওয়াজ পসিবল ফর মি। অনেকে হচ্ছে আপনার ট্রাস্ট গ্রেড ডক্টর পাথওয়ে থেকে ST3 ইন্টারভিউতে ওরা ঢুকতে পারে। It's also possible for them, but এই ইন্টারভিউ দুইটাই হচ্ছে খুবই কম্পিটিটিভ, আর দুইটা ইন্টারভিউর মধ্যে হচ্ছে ডেফিনেটলি ST3 ইন্টারভিউটা বেশি কম্পিটিটিভ। আর এটাতেও যদি না হয়, ট্রাস্ট গ্রেড থেকে হচ্ছে আমরা ট্রাই করতে পারবো হচ্ছে ট্রেনিং এ ঢোকার জন্য, বাট অনলি অ্যাট ST3। তো ধরেন আপনার যদি আপনি ইকুইভ্যালেন্ট টু মেবি 5 years of training, so technically আপনি হচ্ছে ST5 এর ইকুইভ্যালেন্ট, আপনার ট্রেনিং প্রোগ্রামে ঢুকতে হলে সেই হচ্ছে ST3 থেকে ঢুকতে লাগে। এটাই হচ্ছে সব থেকে বড় মানে একটা ব্যারিয়ার আমাদের জন্য, যেটা হচ্ছে ওই আবার নতুন করে ট্রেনিং শুরু করা, আবার হচ্ছে যে সার্জারি আমরা অলরেডি পারি ওইটা হচ্ছে একদম জুনিয়র পজিশন থেকে শুরু করাটা একটু চ্যালেঞ্জিং। তো সব থেকে আইডিয়াল হচ্ছে যদি আমরা আইদার মানে CT1 বা ST1 এ ঢুকতে পারি, না হয় হচ্ছে আমরা যদি ST3 তে একবার এন্টার করতে পারি। আরেকটা অপশন হচ্ছে আমরা একবারে পুরো ট্রেনিং নিজের মতো করে কমপ্লিট করে একবারে হচ্ছে কনসালটেন্সি ইন্টারভিউতে আমরা যদি বসতে পারি। এই ইন্টারভিউটা আবার দেখা যায় আরো বেশি কম্পিটিটিভ। তো দেখা যায় যে এই সিসিটি পাওয়ার পরেও, বিকজ ইউ হ্যাভ ট্রেন্ড অ্যাজ আ ট্রাস্ট গ্রেড অ্যান্ড নট অ্যাজ আ ট্রেনি, এই ইন্টারভিউটা পাস করাটা একটু ডিফিকাল্ট। মানে ডিফিকাল্ট বলতে হচ্ছে it sometimes takes more than a year, it can even take up to 3 to 4 years, which is often quite a challenge for most international graduates. So আপনার কোয়েশ্চেনের আনসারটা হচ্ছে হ্যাঁ, definitely it's possible, but it's lengthy and it's only possible inside certain stages of training. আপনার সেকেন্ড কোয়েশ্চেনটা ছিল হচ্ছে আমরা কি মাস্টার্স করতে পারবো অ্যালংসাইড আমাদের ট্রেনিং এর সময়? ডেফিনেটলি করা যায়, স্পেশালি ন্যাশনাল ট্রেনিং এ যখন আমরা ঢুকি তখন হচ্ছে একটা ইয়ার অফ নেওয়া যায় হচ্ছে একটা মাস্টার্স কমপ্লিট। ইভেন স্পেশালিটি রেজিস্ট্রারদেরকে দেখা যায় যে ওনারা অনেক সময় হচ্ছে 3 বছর গ্যাপ নেয় হচ্ছে যাতে পিএইচডিটা কমপ্লিট করতে পারে। সো এই অপশনগুলো আমাদের জন্য অ্যাভেলেবল থাকে যদি আমরা ফুল টাইম মাস্টার্স করতে চাই। বাট মাস্টার্স এর জন্য যেটা দেখা যায়, যেহেতু এটা ফুল টাইম করলে 1 ইয়ার লাগে আর পার্ট টাইম করলে দেখা যায় 2 ইয়ার্স বা 3 ইয়ার্স এর মধ্যে শেষ করা যায়। অনেকেই হচ্ছে ট্রেনিং এর অ্যালংসাইড এটা করে যদি একাডেমিক প্রেসার বেশি না লাগে। বাট আউটসাইড অফ দ্যাট যে কোনো সময় হচ্ছে আপনার ইচ্ছা হলে একটু টাইম অফ নেওয়া যায়, স্পেশালি ফর একাডেমিক পারপাসেস। এটাতে খুব বেশি হচ্ছে হেলথ এডুকেশন ইংল্যান্ডে আমার দেখা মতো কোনো কমপ্লেন এখনো পাওয়া যায় না। আর ওরা most of the times they're quite supportive about this. Okay, hope that helped. Moving on to our next question. Hearing that UKMLA is coming, what about that? Yes, you're right, UKMLA is coming. And the exact date that it's the exact year that it's supposed to start is supposed to be 2023. UKMLA should not be as difficult of an exam. So far, the amount of announcement that we've gotten from GMC is that it's going to be quite similar to Plab, and all UK exams have the same pattern, where in order to pass the exam, you're just going to have to practice many questions of the same pattern. আপনারা যারা হচ্ছে এখানটাতে প্ল্যাব 1 বা প্ল্যাব 1 প্ল্যাব 2 বা এমআরসিএস এমআরসিপি কোন একটা দিয়ে আসছেন, সবাই বলবেন যে ওই কোয়েশ্চেন ব্যাংক প্র্যাকটিস করার কি পরিমাণ ইম্পর্টেন্ট আমাদের জন্য। তো দেখা যায় যে ওই যদি UKMLA আসে, and if that's the exam that we need to pass in order to get GMC registration, the best way around it would be to practice many questions that they give us as a question bank. For the first few batches, it might be challenging in the way that you won't get a lot of questions to practice from, but I'm sure that they will give you a question bank to practice from, the proper resources that you will need to practice from. So it should not be something that you should be dreading that, oh my God, I'm not going to get GMC registration once UKMLA comes. If I explain the logic behind this situation is that the UK is in need of doctors. They're not going to give an exam which will be impossible to pass. They're not going to throw an exam at international graduates because they depend largely on international graduates in order to run the NHS. So inshallah, UKMLA should not be too difficult. I can't say anything more about UKMLA at the moment because we don't have enough information available. But if I do get to know about it, I will encourage IFMSA Bangladesh to help me speak about the topic so that we could help anyone who wants to join the NHS in the near future to know more about it. Okay. Hope that helped. Our next question is, hello Apu, about the courses. Do I have to complete them in the UK? Or if I have done some in Bangladesh, it works as well, like the ones in IFMSA, Basic Surgical Skills, ATLS. This is an excellent question, and I was very concerned about this when I came to the UK as well, because much like yourself, I've also done Basic Surgical Skills thanks to IFMSA Bangladesh, and I was wondering if it was going to help me in the UK. Unfortunately, many of the courses that you need for your core training interview have to be done in the UK because they have to be acknowledged by the Royal College of Surgeons England. A lot of people might say that there's a bit of a commercialism going on over here as well, because if you don't have it done under the Royal College of Surgeons, there's many courses which they won't accept. So some of the courses, for example, Advanced Trauma Life Support, Basic Surgical Skills, you will have to do them once you're in the UK. But other skills, for example, if you have for example, before I came to the UK, I did a certificate course on medical ultrasound. Many of you know about CMU. They had accepted that as a postgraduate certificate course. So certain skills in these will work, but a lot of them you would need to redo in the UK. But believe me, I learned so much from it that it would actually be worth it. So I learned basic surgical skills in Bangladesh, and then I did it again in the UK, and I learned some new things because each country works in different way in terms of skills, and I did enjoy it, to be honest. Hope that helps. Moving on. Okay. If someone completes Plab MRCS Part A, is that okay to get a job? Which type of job? Run through or uncoupled? Okay. Mimi, Afsana, I'm very happy to hear from you because this is exactly what I did as well. I completed my Plab and then I gave my MRCS Part A, and then I got a job in the UK as a Foundation Year 2 equivalent. It is definitely enough to get a job. I started applying for jobs before I passed my MRCS Part A, and I definitely got more calls for interviews after I finished my Part A. It's not mandatory. We have tons of colleagues over here who are doing Foundation Year 2 after passing Plab who don't have MRCS, and that's fine, but it's a bit easier if you have Part A. So yes, you can definitely get a job. Once you get a job in the UK, you will have to build up your CV in order to try to join a training program. Now, the training program over here, I'll go through this slide again, which is when you're inside this, in your training program, you would be sitting for one competitive interview. If you do very well in this interview, in other words, there will be about 2,600 candidates. And if you're amongst the top 100 to 300, you can probably get into a run-through training job. And otherwise, you'll get a core training job. Core training jobs are not bad because if you're doing a core training job, at least you would be getting the training according to the national training scheme. You will have an educational supervisor who will help you with your making sure your competencies are signed, making sure you get time in theater. So either one is not bad. Run through and uncoupled training, both are amazing and both are great opportunities for international medical graduates. So yes, the answer to your question is that you could get, initially you will be getting a trust grade job. All international medical graduates come into the UK and join a trust grade job. Then you can come here, build up your CV, and then join to become for a training job, which would be a run through or an uncoupled job. Okay, the next question is, if I complete 6 months of honorary training in Bangladesh, does that count as FY1 or FY2? Okay. Now, if you completed your internship, which has to be at least 12 months, only then will it be counted as FY1. So if you did not do 12 months inside a particular hospital, which is termed as a training hospital, for example, your own medical college or another medical college, you will not be able to make it an FY1 equivalent. If you do honorary medical training, and there's a certificate you can download from the internet called the Foundation Year 2 Competency Form. If while you're doing your honorary medical training, if you get your consultant or the professor, head of department to sign that form, then you can count that as your Foundation Year 2 equivalent. I know many doctors in Bangladesh who've done that, come here and then sat for their core training interviews. So yes, you can do that. You can do, so the minimum time you require for getting your Foundation Year 2 competency signed is 3 months. So if you do 6 months, that is possible. Don't worry about it. You can get your Foundation Year 2 competencies signed. But for Foundation Year 1, you need 1 year inside a training hospital. The next question would be, what positions can I work in if I come back to BD after becoming a consultant in the UK if I have no postgraduate degrees from Bangladesh? Okay, so the important part inside this is that you have completed your training inside the UK, and so you would probably have MRCS and FRCS. And then you would be becoming a consultant. and then you'll be returning back to Bangladesh. So as an MRCS or FRCS, a doctor with MRCS or FRCS with certificate of completion of training, you would be able to work in many of the private hospitals. For example, you would see many of the doctors inside Apollo Hospital, Square Hospital, who have these international degrees and are practicing. So you would be able to work in these hospitals. However, if you're thinking about getting a government job, it might be a bit difficult. The reason being that some of the basic requirements for getting a government job will be doing some years inside government training, completing your FCPS, completing your MS or MD. So it will be a little difficult. To be very, very honest with you all today, very few doctors after completing their training inside the UK come back to Bangladesh. If the doctor does not like the conditions in the UK, many doctors migrate to Australia, many doctors migrate to Saudi Arabia, Dubai, etc., many countries in the Middle East. The main reasons being that the pay is often a bit better, and certain times, particularly for a lot of people, if you think about cultural values, where there's an Islamic majority, or where there is people who are, in order to become close to your friends and family, you could be going into other countries, but most doctors do not prefer coming back to Bangladesh. The reason being that without, first of all, the surgical practice that you would be doing in the UK and that in Bangladesh are very, very different. When I was working as a honorary medical officer before I moved to the UK, all of the consultants and all of the registrars and junior doctors, we were taught how to do a open appendectomy very well, and every time I'd be able to do it, I'd feel very happy because I'd feel like this is a very important skill as a surgeon. When I moved to the UK, it turned out that about 90% of the appendectomies are done laparoscopically, and so the skills that you have in open operations are not as important. So as the years go by, the gap inside practice between Bangladesh and the UK will probably become more and more, not because any country is better or worse, but just because the practice is different. If you've trained in the UK for about 8 to 10 years, the surgical practice you will learn is quite different from Bangladesh, which makes it kind of challenging to go back and start practicing again. But yes, you can work in private hospitals and your degrees will be acknowledged. CBD and KEX, a little explanation about these. Okay, so CBD is a case-based discussion, and KEX is a clinical examination. These are certain discussions that you will usually do with your registrar or a consultant. For example, a patient comes with an open fracture of the tibia. If you discuss this with your registrar, you'd be able to have, usually it's a very informal discussion. For example, this was what the patient came in with, what are the proper investigations, what is the management, etc. Once you discuss it, you send them an online form through your online portfolio called the ISCP in the UK. And all your registrar has to do is just say how well you've performed inside the question and answer, casual informal discussion, and sign it off. Generally, once you enter the training inside UK, you need about 10 to 12 CBDs and clinical examination, or KEX, every year. And personally, from my experience, it is not difficult at all, because you will have many, many cases to discuss in the hospital, especially during your on-call shifts. And when you discuss these, when you ask your registrar, can I send you a CBD form? Most of them are very, very happy to do it. It doesn't take them too much. All they have to do is just write a few sentences and sign it off. So getting your KEX and CBDs are quite easy in the UK. Okay, moving on to the next question. What kind of feedback form can be used as evidence of teaching or clinical experience? Does it have to be an official form? How did you prepare for your portfolio on your first job in the NHS? Okay, so the question was about the teaching form. So feedback forms can be of all different types. I'm just going to give you an example of some of the forms that I've used for my own training applications. So the NHS does have a particular form which they prefer. So this is an example of it. It's a feedback form which just has certain criteria to fill out. For example, who was the one who presented it, whether you did well, or how useful the content was, do you feel confident about the topic, etc. If you'd like, I can post a link to this inside the event page in order to make sure that if you are planning to get some feedback from Bangladesh, you'd be able to get it. However, they are not too strict about this. I've worked, before I started working in the UK, I've worked for a small period of time as a language of medicine trainer in Augmedics Bangladesh. So over there, we got our feedback forms, which were completely different. And I used this inside my portfolio, and I was able to get the maximum amount of marks. So in this case, they're not too fussy about how you get your feedback, but to make sure that you are, just to make sure that there is a definite form of honesty that you have taught, and your students are happy with the way that you're teaching. And the next question is, how did I prepare my portfolio for my first job? So my first job was a trust grade job, or a non-training job. And I didn't need to prepare a portfolio. I just needed to prepare a very well thought out CV. I can upload an anonymous CV on the event page just to give you a better idea, if this helps. The second thing is, your CV should just include all of the achievements that you've done so far. Now, the next part is, how did I prepare for my core surgical training interview? That is a whole different story. If I just give you a brief of how the portfolio was organized for me. This is an example of my portfolio, and obviously it includes your CV, it includes the different achievements that you have done, all of the segments, 10 segments that I've told you that I had to complete. And each of these contain all of the information that I have gathered and organized, some of them which I've achieved from Bangladesh, and some of them which I have put together after coming to work in the UK. The best way to come about this is to look at the portfolio checklist, which I'll be posting on the event page today. And once you have that, you'd be able to know what things you need to achieve and what are the things that you would need to obtain in order to give yourself an extra edge on the interviews. Okay. Apu, can we ask questions via audio? Yes, you can. Onabil, are you there? Hello? Okay.
I'm here, but I already wrote my questions.
Oh, okay, okay, wonderful. Okay, sorry I didn't get to you earlier. Okay, I'll go to your question in a little bit. The next question is, what is the difference between interviews to get into uncoupled training and the run-through training? The answer to your question is there is no difference. For example, general surgery, which is the specialty that I am focusing on, there was just one interview called the core surgical training interview. And if you had scored well enough in the interview, you would be getting a run-through job. And if you did not score as well as some of your other competitors, you would be getting an uncoupled job. So there's just one interview. How you score on it determines whether you would be doing core training for 2 years and then giving an interview and going to ST8, or would you be going for a run-through job straight from ST1 till ST8. So the answer to that question is that they're the same interview. However, two specialties are a bit different from core surgical training, which is cardiothoracic surgery and neurosurgery. Here, the two interviews are completely different, where you'd be having to give just one interview for ST1 for cardiothoracic surgery and a separate interview for neurosurgery. These interviews are held on similar grounds, but because I haven't personally attended these interviews, I don't have first-hand experience on how those interviews would be, but The stations are exactly the same. You are given a station for clinical scenario, one for leadership and management, and one for portfolio. Moving on. Okay. What kind of feedback form can we use as evidence for teaching and clinical experience? Can any form be prepared by an individual, or does it have to be in an official form? How did you prepare for your portfolio for the first job? Okay, so similar to the question that we had earlier, yes, they are not too fussy about how your form is, because they do have one which is available inside the joint surgery and physician's website, which is the feedback form. But if you use something else, for example, I used my feedback forms that I got from Augmedix Bangladesh. This was also okay. They're not too fussed about which form that you use, but I think one of the questions that you asked was about the clinical form. So about your KEX and mini KEX, this has to be through an online portfolio. It will be very challenging for you to find someone with an ISCP portfolio in Bangladesh. So it's best that you get the KEX and mini KEX done once you start working in the UK. So generally, what's the natural course of route for all international medical graduates is you come to the UK getting your GMC registration, you start working as a non-training doctor at first. And during this time, you get your KEX, your mini KEX, you do all of your courses, and then you sit for the national training interviews. That way you will have all of the things that you require in order to win the competition for the training. The next question, how do you prepare your portfolio for the first job in the NHS? So I didn't need a portfolio for the first job because it was a non-training job. I applied through the NHS jobs website. And if you go to the website and open an account, they'd give you special boxes where you can put in your experience inside, your academic experience, your work experience, etc. All you have to do is just fill in those boxes. You just have to make sure that your NHS jobs portfolio stands out, and the fact that you're using very interesting words, good English, and most of the times after a few job applications, you will definitely be able to get an interview. And once you give the interview, you would, the overall interview is, so I gave my interview while I was in Bangladesh. So the interview was one over Skype. So they asked me a clinical scenario. It was about a patient who had surgery a few days back, swollen ankle, and they were asking me what is the possible, and then suddenly difficulty breathing, and the answer was the patient had deep vein thrombosis, and eventually it progressed into pulmonary embolism. And how will you manage this patient? Check their airway, breathing, circulation. There are certain books and guides that you can use in order to pass these interviews. I'll be more than happy to provide you some if you ask me. The next question was, Apu, did you teach during your undergrad years in medical college? Was it difficult to get a signed certificate from the departmental head and convincing juniors? So, Onabil, if you know how kind most of the juniors are inside Bangladesh, you would know that usually it's not too difficult. So if you ask some of your if you ask one of your juniors that, can you just fill in a form, they will more than happily do it. So for me, it wasn't a challenge. Yes, I did teach medical students when I was an undergraduate, and to get your consultant to sign it is usually not too much of an issue either. The reason being that if you have actually done the teaching and someone has saw it, they're definitely going to sign the form for you. So you, getting these signatures inside Bangladesh is usually not too much of a challenge because most people are quite helpful minded. But again, you do have to make sure that you ask the right people and that they are willing to help you, not when they're busy or doing something else. Next is, how did you enlist your various experiences from being national officer, attending seminars on your portfolio? Did you submit a certificate? Or did you describe your experiences? Okay, so Onabil, I hope you are watching this, which is what I did was, so all of these achievements do have to be organized inside your portfolio, as I've mentioned a while back. I'm just going to show you how I presented this inside my portfolio. So if this is your portfolio, for example, you have one for presentations. When you open this, there's a table of contents on what you have done. So inside my part, I put a slide of, I printed out the slides that I have presented for my portfolio. I put in the certificate of participation and the fact that it was published by, in the BIMSCON journal inside here and the International Journal of Medical Students, in order to prove that I had actually taken part inside this. In order to show my teaching experience, it was quite a similar process, which so in teaching experience, you're going to get, for example, language of medicine trainer, and then this is the parts that I have done. In terms of the courses, training courses that I have done, again, your courses such as basic surgical skills and other courses that I have done mainly in the UK, you organize the certificates like this. Some of them you'd give the feedback forms as well. And this is basically how you present your portfolio. This is the one on medical ultrasound that I have mentioned, some other ones here and there that we have done. Okay, I hope that helps. Moving on to our next question, which is, after completing MRCS, should I start from ST1, ST2 or from CT1, CT2? Okay, so Tawfiq, ST1, ST2 and CT1, CT2 are basically the same stages of training. So after MRCS, you can go for either one, but the problem is after MRCS, if you already have more than 18 months of training, unfortunately, you won't be able to present yourself as a candidate for the core surgical training interview, which means neither of these would be a very feasible option for you. Because as I mentioned before, for this interview, you have to have 18 months or less of surgical experience. So if you have, let's say, 24 months of surgical experience, your next step should be trying for ST3. However, if you have somehow managed to complete your MRCS before having 18 months of clinical experience, yes, you can definitely sit for this interview. Personally, I will encourage all international medical graduates to try to get for a run-through training. The reason for this is because run-through training is one where you don't have to worry about interviews for 8 years of your life. You don't, many people have to give a gap year between CT2 and applying for ST3. If you're in a run-through, you don't have to do this. The training that you'll get as a surgeon, if you're thinking in form of, I'll try to develop myself to be a surgeon in the future, you need to think about how well you can develop your own skills, especially when it comes to those operative skills. So you need a teacher or a trainer who is going to guide you and invest their time and energy into training you. It is so much easier if you have a run-through program where you have 8 years with the same department than one where 2 years inside one particular deanery and then 5 years in the next, the next 6 years in another deanery. Yep. Our next question was, what are the ways to gather some points for teaching experience and train a teacher? Thank you for answering the answers clearly. Thank you. If I wish to migrate to Canada or Australia, if I wish to. Okay, so what are the ways for gaining experience for teaching? So there are 2 ways that you can gain experience in teaching. One is back in Bangladesh and one is once you come here. So in Bangladesh, the best way to gain experience in teaching is to either get a teaching job. I know they're quite competitive inside Bangladesh, but oftentimes you can join as a lecturer post. So this will look really marvelous on your CV if you can join as a lecturer post and get a certificate stating that you have taught, and also get feedback from your students. The other thing that you can do is once you come here, most hospitals are university hospitals, which means that there are medical students who are studying here as well. So if you teach the medical students, usually it takes about 1 or 2 hours of your time from the hospital once every 2-3 weeks. And if you get a certificate for that, that's also a way you can get knowledge, you can get your experience inside teaching. The other question that you asked is, how do you get your points for training as a teacher? Now, unfortunately, in Bangladesh, there are only a few limited options, but in the UK, there's a 2-day course that you can do called Teach the Teachers or Train the Trainers. So your Teach the Teachers or Train the Trainers course, you would be able to just, you just basically learn how students, what are the different techniques that students learn, what are the different teaching techniques. And once you cover all of these points, you would be given the certificate. So it's quite an easy way to earn points for your portfolio. The other more difficult way to get marks for training as a teacher is doing a PG certificate on teaching, which is usually about 1 year in duration. So if you do this, you would definitely get points on your portfolio, but unless you are passionate about teaching, I wouldn't say that it is essential. There are many ways that you can get the point without doing this, without spending an entire year on learning how to be a good teacher or trainer. Your next question is, at which point of the training can I migrate to Australia if I wish to? It's actually an interesting question because once you get GMC registration and you've worked in the UK for 1 year, you are eligible to migrate to Australia without having to give the AMC exam. So that means you will have license to practice in Australia after. So what would you need? You'll need GMC registration and you'll need 1 year of hospital working experience in the UK. Now, but why is it, if it was that easy, why aren't a lot of doctors doing it? The issue is that the job availability inside Australia is much, much less compared to the UK. So it turns out that getting a job is a little more difficult in Australia. The second thing is getting a job of your choice is often a bit difficult. For example, if you want to get a job in surgery, but there are none of them available, you might have to pursue your career inside a different field. For example, maybe general practice or inside another branch of medicine or obstetrics and gynecology instead. So in Australia, you can migrate to Australia, but it is a bit more challenging and challenging to get the job that you would want in the specialty that you want. But it is possible after just 1 year of training in the UK. The next question was, okay, who can sign the FY2 competency form? The answer to that question is any consultant can sign your FY2 competency form. So if you have a consultant from the UK signing your form, they would need to put in their GMC registration number and their hospital email address, and that's it. If it's a consultant from overseas, they're going to have to attest their own hospital card. So you'll know that most of your professors, assistant professor, associate professors will definitely have a card which contains their specific details, for example, their name, their phone number, their chamber address, etc. So they would have to attest that, and you will need their BMDC license number as well. So as long as you have their signature on the form, their BMDC registration number or any registration, national registration number, and their hospital identification card, any consultant from around the world can sign your FY2 competency form. The rules are that in order to have a consultant sign your form, you will need to work with them for at least 3 months, and you would have to have it signed within 3 years of when you're submitting this form. For example, if I'm submitting this form for my interviews in 2020, the form must be signed anytime from 2017 till 2020. If I have a form that's signed in 2014 or 15, it won't be valid. Yeah, hope that answers your question. Moving on, is it possible to build an e-portfolio in Bangladesh, and will it help to get a training post inside the UK? This is honestly a very tricky question because you can have an e-portfolio in Bangladesh, but how much of it you will be able to get filled out is a bit it's kind of a hit or miss, because first of all, the surgical portfolio, it's called ISCP. It's the Intercollegiate Surgical Portfolio, which is about £260 every year. So this is about আমাদের দেশি টাকায় কত হচ্ছে 26,000 27,000 এর মতো পড়ে যাচ্ছে. So with this amount, you will have to be doing surgical procedures and getting someone to sign it. Now the problem is, if your consultant does not have an ISCP portfolio, it becomes a bit difficult for the GMC to validate them as a proper person to sign it. So the best way for an e-portfolio is to come to the UK, start working here. Filling out your portfolio once you start working in the UK is quite easy, the electronic portfolio. Especially if you're a junior doctor and you express your interest on getting into training. Most of the seniors that I have had worked with are quite supportive of this decision. And to be very fair, they have no reason not to sign it off, because if you want to get into training, if you show that you have the proper knowledge for becoming a trainee in the UK, they have no reason not to help you. So most of them are quite helpful in terms of helping you fill out your portfolio. Okay, the next question is, and yes, if you do have a e-portfolio, it will definitely help you get a training post in the UK, but it would be easier for you to get an e-portfolio once you come to the UK. When did you start preparing for MRCS Part A? So I've passed my Plab exam in October 2018, and the day I got my Plab 2 result, the fact that I've passed, I started preparing for MRCS Part A. So I took the time from October all the way till about the middle of January to prepare for MRCS Part A. But even before that, I've gone through a few books here and there. If your main question is how long does it take to prepare for MRCS Part A, I would say the best time would be anytime from 3 to 4 months. But we'll be doing a webinar on MRCS in late this month, so please tune into that. We'll be discussing all of the things that you need to know about MRCS. I have a clinical gap of about 1 to 2 years. How much impact will that have in pursuing a career inside surgery in the UK? So what they mainly look for is what your clinical gap was for. So if you can show the reasons for your clinical gap, so for example, I had a gap when I was preparing for Plab 2, so right after internship all the way till I joined the NHS, I did take some time off because I was preparing for Plab 2. I was going to the UK to get my GMC registration, etc. Once I showed these, it was not a problem at all, because they do see that, okay, you have a reason for taking your gap. Particularly for women, if you show that you have a maternity leave, they would accept it for sure. Any form of social leave, they will accept it as well. So clinical gaps generally do not have too much of a downside to it, but make sure that right before your interview that you don't have this clinical gap. For example, if you had your clinical gap years ago, you've now come back into work, and you have been working in a particular position as a trust grade or in any job for about 1 year. After that, if you apply, they will not be looking at what you did that many years back. It should not have too much of an impact, but it is basically how you sell yourself in the interview and make it seem like the clinic, you have to make yourself come off as if the clinical gap is not something that comes to your disadvantage. It shows how organized your portfolio was, really helpful, cleared a lot of confusion. Thank you so much. My pleasure. Please do let me know if you want any more information. Can you tell us about Augmetics in short? So Augmetics is a company in Bangladesh which trains scribes. You can find a lot about it in its website, and yeah, it was one of the jobs that I've used in order to get my points inside teaching, and it did help me. Thanks a lot. Really concise and helpful. Learned a lot. Thank you for your time. Okay. You're very welcome, Afsana and Wasi. I would like to ask a question using audio. Faridul Islam, are you there? Can you ask your question on audio, please? I have a little confusion about the 18-month experience of, is it in surgery experience or overall clinical experience? Faridul, if you're there, please do ask your question on audio. But until then, I'll be answering your question, which is yes, it's 18 months only in surgery. So one of the ways that lots of international medical graduates bridge this gap is by showing their experience, by working in fields which are not in surgery. For example, if you've worked inside, so I'll share my own example, which was right after internship, I worked as a honorary medical officer in the casualty department inside Dhaka Medical College. And I've put this as a branch of emergency medicine because it's the first point of contact, even though technically you can get surgical exposure. Once you start working in the UK, if you see that you're too close to 18 months before your training interview, you could start working in accidents and emergency medicine, gynecology and obstetrics, so that you don't cross 18 months before your core surgical training interview. Yeah, thank you, well explained. Okay, cleared a lot of confusion. It was my pleasure to explain all of this. And if you do have any further questions, please don't be afraid to, you can knock me on Messenger, or you can put in your questions and discussions in the event page. I will be more than happy to answer. I sincerely apologize for some of the technical issues that occurred earlier today, because initially when we did try to set up the audio, there was some problems. Unfortunately, these do happen inside webinars, but I apologize for taking up your time for in which we had to delay the session for a little bit. But I hope we were able to cover most of the learning objectives and clear out some of the confusions that we have regarding how to enter into surgical training. One last question that we have, you mentioned the expense of Plab, MRCS, and some courses. If you don't mind my asking, how is the pay through the training, and how is it possible to support oneself through these costs? Okay, I think this is actually quite an important one and a good one to be ending the session on, which is, so initially for your Plab exams and MRCS Part A, in most of the cases, if you're giving it from your home country, you would probably be having to save up for this and pay for it with your own pocket money or with the help of your friends and family. Once you start working in the UK, your initial salary would be, and as a foundation year 1 or 2 equivalent, would be anywhere between £2,000 to about £3,000, যেটা আমাদের দেশি টাকায় 2 থেকে 3 লাখ টাকা হচ্ছে. If you are a person living alone without a spouse to support and without children to look after, usually this is quite a this money is good enough to support yourself and your courses initially. So when I first moved to the UK, with most of my salary, I would be saving it up in order to attend courses, make sure that I'm sitting for the exams, and to make sure my portfolio is well developed. But once you're done with all of the courses and stuff, you would be able to have a bit of savings. And as you progress on into joining as a CT or an as a CT1 or CT2, your salary slowly starts to climb up to something around £3,000 to £4,000 every month, which is, and I'm talking about all of these amounts without tax. So this is after tax has been deducted. So with this amount of money, you would definitely be able to afford the courses. I know many of my colleagues who are core trainees, and they are able to I know someone who needed to do the ATLS course very badly before their ST3 interview. They had enough money and savings that they went to America, did the ATLS course, and then came back to the UK. So usually after the initial few, maybe 6 months to 1 year of working in the NHS, finances are not too much of a challenge. Again, A lot of these vary from person to person and circumstance to circumstance, but in general, paying for these courses is not too difficult. There's also a very good system inside the UK where you can work out of hours, for example, on your off days or on weekends. These are called locum shifts. So before my own core surgical training interviews, I found out that I needed to spend quite a lot of money on courses, and in order to make sure I had enough money for this and I was not putting myself inside any financial constraint, I did a few extra shifts. So these extra shifts, কিছুটা বাংলায় আমরা যেটা খ্যাপ মারা বলি, it's a more of an informal term. We do similar locum shifts like that over here, and you're getting about a good amount of money, anywhere in between 200 to even up to 500 to 600 pounds each shift, and you would be easily able to pay for your courses and your exams. So it's usually not too much of an issue. And yes, you can probably be paying, supporting yourself throughout for all of these costs. Yeah, I really hope that helped, and hopefully we'll be doing a session on MRCS in our next webinar, and I hope all of you enjoyed it, and thank you very much for being with me, and I hope you all have a very nice day. All right, take care, goodbye.
Thank you so much, Emiko Apu. It was amazing. And for the participants, we have another upcoming webinar at 31st of May. You make sure to tune in to that webinar. And can we have a round of applause for this amazing session for Emiko Apu?
Thank you so much.